Hi, my name is Ogweno Stephen. I'm the CEO and founder of Strelink. Strelink is a youth-led social enterprise whose primary ethos is to make information and diagnostic services for non-communicable diseases available to all at all times in relevant formats. We implemented a project in 24 institutions of higher learning. The project was called the Drug-Free Youth. And in this project, we were educating young people in schools and communities on what drugs are, how to recognize drugs, how to say no, which speaks to refusal skills, but also how drug abuse connects to non-communicable diseases. This project was innovative in various ways, including the fact that we were able to use poetry as a means to communicate messages on drugs and substance abuse. And as a result of the whole of the work of that project, we were able to produce this book, which is a collection of young people's experiences with drugs and advice on how to prevent, how to say no, and how to avoid using drugs for young people. The other way that the project was innovative was the fact that the project leveraged on social media as well. So we had a poetry contest with young people to reach them. We were able to reach young people from 4 countries in Africa: Kenya, Uganda, Tanzania, and Zimbabwe with this project. And you could tell that even though the project was primarily focusing on Kenya and addressing drugs and substance abuse in Kenya, the problems of young people in the continent of Africa are the same. And young people in Africa have the same experiences and they want to share the same experiences. And that is one of the realizations that we had in 2019, which also contributed to us developing a new project in 2020 and 2021 subsequently. And so back to the Drug-Free Youth project, whilst we also used technology and social media to create this change, and we used poetry to speak to this, we also collaborated with organizations like NACADA to be able to train institutions of higher learning. So this is universities, colleges, but also some primary and secondary schools on the topic of drugs and substance abuse. And whilst we were doing this project, one of the biggest impact we saw was how young people grasped the concept of drug abuse, but also how they grasp the concept of refusal skills. Because most of the time when discussions on drugs and substance abuse happen, it's purely information-based. I come, I tell you what these diseases are, and then I don't leave you with what next and action points. And so when we solved this gap and we came up with this project and we taught young people refusal skills and we put them in school groups, the health clubs is what we worked with. So the project outlived our period of implementation for it. And this speaks to some of the best practices and some of the new innovation of how to do projects that really convinced us that we needed to share this with a wider audience. And the Quality Healthcare Kenyan Awards was a platform for where we could be able to share this with relevant stakeholders and hopefully expand the reach and the impact of the project. And this specific award was applied under the Student Innovation Project of the Year because most of its implementation was done in very close partnership with Kenyatta University, and with us while we're implementing this, we are still students. So that is how we're able to apply under that category.